Well, it's a privilege to be here. It's funny, just in listening, you start talking breastfeeding for a minute, and I'm like, ugh. So I just had my second born. I've had both my kids in office, and which apparently wasn't a big. I mean, that's a thing. Like that doesn't happen a lot. And I just laugh because y'all talk about how to help ladies breastfeed. Nobody talks about how you stop breastfeeding. Like I almost brought my 2-year-old, and I thought, no, he's gonna sit on my lap and pull up my shirt and say boo, boo. And I thought, which here would have been well received, but it's been awkward at times. Okay. It's been very awkward. And now I'm to the point where it's like, it's one of those things you don't want to give up. But I always said, when he's talking, that's gonna be the time. But yeah. So anyway, that would be helpful. Like a follow-on would be helpful, like how to transition. Although I was proud of getting to the point where I was breastfeeding him regularly. And I'll talk about both my kids in a minute, but with my first, she was a 28-week preemie. And so I pumped with her. She had breast milk for a year, which if you've ever exclusively pumped, it is the worst thing in the world. It is terrible. It is so not, you don't bond with a pump, but you feel like you're bonding with a pump because you're with this pump all the time. So, but this is definitely a subject that's near and dear to my heart for many reasons. I feel like I have a unique platform because both I get to be in Congress, but I'm in Congress as a mom, and not, there are moms, I think out of the 11,000 of us who've served, there's under 300 women who've served in that time. So I would guess a majority were moms at some point, but a lot of them are grandmas by the time they get to serve. There's a lot of wisdom there, but there are not very many who have their kids in office. And I feel like being in the trenches right now on that front has actually helped me. I think it's probably my greatest privilege to be a mom, and I count it one of my greatest privileges to get to serve. But it has given me a really unique perspective and a desire to advocate. So let me say thank you to you all. My mom, I'm from the West, and breastfeeding is like a way of life. You come here and people are like, whoa, what is she doing? But at home, it's kind of, culturally, it's becoming a very normal thing, especially in this generation. I was sharing, my husband and my friends, we all, everybody's got lots of kids, and you're not uncomfortable with your husbands in the room, right? It's just not you don't even think about it. But I know it wasn't always that way. And I know that that's in part due to folks in this room who've been laboring in this field. And I appreciate that very much. My mom was very hippie-like and definitely breastfed us. But I even talk on both, as my mother-in-law, which they're going to love the fact that I'm talking about this. But their generation before them didn't necessarily. In fact, my mother-in-law's talked about different challenges that she had. Her mother-in-law had 6 kids, and breastfeeding was not a thing you did. It just wasn't something that was promoted. And so I recognize there's been a lot of push in this area, and there have been different trends, but I think what you're doing is taking hold, and it's so critical. It is so critical for so many reasons. I mean, one of the things that our previous speaker talked about, which talked a lot about health and safety, and I think in this day and age, the mental health of our children is so critical, and this is one of those things. And maybe there's science behind it, but there's also what we're learning. We're on the verge of being able to describe it more now, and I think this plays a critical role in that as well. Okay, let me move past. I hear a lot from different parents about what goals are, and I think one of the first things that caused me to want to start the Maternity Care Caucus was when I had to start schlepping breast milk through TSA. And I thought, oh, this is just me, because, I mean, how many moms are leave. I remember like filling coolers and getting the dry ice and duct taping it and putting these big nasty notes on it to TSA, like, this is for a hospitalized infant, TSA. Do not unthaw this milk. And they never opened it, right? But I think it was because I just didn't know what to do other than, you read it online and that's how you figure it out. But then when you start carrying the smaller bags and then, somebody's opening it and spilling it, and you can't buy that on the other side of TSA, right? And I started going through those experiences, and just, someone walking by, you do the pump, and the guy's like, where's your baby? And I'm like, well, if I had the baby, I wouldn't need the pump, right? And all these experiences, once I started realizing the horror stories that are out there, that was probably my first kind of experiential smack in the face about the challenges that moms, traveling moms, are going through in families with regard to helping their babies. And that was one of our first bills. We called it the Babes Act Breastfeeding. Oh man, I'm not remember the acronym, but it was signed into law. And it simply just said, and I've had to educate many a TSA agent, no, you need to look at, here are your guidelines. This is what you're allowed to do. This is how you handle it. Trust me on this one. This is law. And it's slowly but surely, they're moving in the right direction. But that was kind of our inaugural. There was a couple other things we got to tackle. It's Lucille Roy Ballard and I. She's from down in California. It's a bipartisan caucus, and she's fabulous. We also got one of our first big pushes was to get folic acid in corn masa, which was something apparently the FDA had sat on for forever. And we've had it as part, it's been enriched in flours and such for what, 20 plus years, 25 years? And we see at least 28% decrease in things like anencephaly, I'm not going to say it right. And it wasn't in things that certain communities eat. And I'm actually the first Hispanic woman to get to, or not even just woman, anybody to represent Washington State federally. And it was interesting that within that community at home, we were having a whole outbreak of babies with severe encephaly and different things happening, and nobody was able to say why. And we thought, well, why? This is an easy step. Why is it taking the FDA many, many, many years to go ahead and approve this? And as a caucus, this was our first big win. We got a pretty quick reaction, and I'm proud to say it's now folic acid is now part of corn masa, which is a staple of food for certain communities. Lucille and I both serve on the Labor, Health, and Human Services piece of appropriations for obvious reasons. And I think our mission in the caucus is to make sure that we're getting legislative solutions enacted. It's great to talk about a lot of things, and who's against, right? No one's ever against these things, but we were talking about just the top of mind issue in some of these areas, and that was part of our goal in forming this, was to make sure it's front and center at all times, because you either are a mom or you've got a mom. So in my view, it impacts everybody, but we really have had to push to make it top of mind with a lot of other good competing ideas, but you really have to put some muscle behind it. And we had a good year with the omnibus spending bill. We included a $10 million increase in maternal and child health in the block grant program. And the increase, I think, is going to make sure that our goal was to really direct that money to make sure it's going to go to state programs, which currently serve almost 35 million women, children, and youth. And I'm sure some people in here work with money from those programs. And we had another win in appropriations that I don't know if you're familiar with. We secured $8 billion towards a grant for CDC to provide hospital support for breastfeeding. Now, not everybody knows to have a doula. And where I'm from, it's cool to stay home and have babies, which I'm sure some of the docs in the room are like, but making sure that if you're not home with a midwife, right, and if you're in a hospital setting, that you still have that same strong support in the options. Because if you're a new mom, it really is it comes down to what you're exposed to. It really does. And that can be in a tiny little poor rural hospital or a great big amazing teaching hospital in the center of some urban setting. It really has to do with who is the nurse that day, or who is the one that you're interacting with and what they expose you to. So we wanted to make sure that there was money set aside specifically for hospital support breastfeeding. And I don't have to tell anybody here, I mean, you know the clinical benefits of making sure that moms have the support they need to breastfeed their kids, whether it's obesity, mental health, even just the connections for children at a young age, at a time when I feel like we're increasingly asking a lot of young children, whether it's asking them to be outside the home. We're all busy. Most of the people I know in my generation, they're dual income. They have to be, which means kids are not necessarily getting to stay home like I did until I was ripe old age of whenever my mom sent me to school, right? There's different challenges for kids, and I think that this is one of the ways that there's a nice, strong handoff for the little guys, or the older guys who are still breastfeeding like mine. I wanted to mention another piece, and I don't know what you all have talked about so far, but with regard to the opioid epidemic, there's a really large piece of legislation with a lot of moving pieces moving through committee right now. But I wanted to mention this with respect to what we're talking about. There's a bill that I introduced with a colleague of mine, Bill Foster, that improves access to inpatient treatment for women who have substance abuse disorders, who are also pregnant, or who are suffering from postpartum depression. In my view, we need to keep working on policies that are going to support this more vulnerable population. It's surprising how many people don't know, or moms don't know, that they're experiencing postpartum. We've been trying to push some more money in that direction just to help women identify it. But kind of coupled along with the opioid, the trends in who's using opioids tends to be women, mid-30s, right? We're seeing a really big spike, at least in my area, in that population. We want to make sure that women are getting that support that they need. My personal experience has definitely shown me that there is still a tremendous uphill battle when it comes to workplace environments, obviously. Much of what I work on they're not groundbreaking, earth-shattering new ideas. It's common sense stuff that we're pushing through. And we are chipping away at the Old Boys Club in a lot of places. I think we have about 50 lactation stations now on the Hill. We still need a changing table in a few different areas. I don't know if you've ever walked in. I've even walked into restaurants in D.C., and these are, middle-income family restaurants, and I'm like, where am I supposed to change my kit? On the floor? I'm supposed to do this on the floor. So we still have room to grow there, but we are. Actually, we just barely got a bathroom next to the floor during my tenure. We used to have to run across the statuary hall to use a bathroom, right? And the boys' bathroom was, right there. And that's one we can thank John Boehner for. He got no credit for that, but he gave us a bathroom right where the boys' bathroom was. The one thing I do want to make sure we, and I've seen some movement here in the private sector with regard to modernizing pumps. But if you're a working mom, a pump is a huge part of your life. And even if you're not, maybe that's just part of how you want to make sure your kid gets breastfed, or they get the express breast milk. I think they've not evolved almost since they've been made. And there's nothing like trying to be on a conference call where you're supposed to be this professional and you hear, ear, 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 and you're like, just ignore the sound. I mean, I've had to do this. I went to a briefing at the Pentagon. It was a situational update on the nation states of the world that are trying to attack us. And I was like, hey, I have to step out. Is there a place I can pump? And that's really fun to do in that environment. And actually, they're ridiculously accommodating. I was pumping in some general's office, staring at all his artwork, thinking, hope nobody walks in. I blew out a room. I was traveling. I went to Israel with a bipartisan group, and I blew out the hotel's electricity because I thought I bought the right adapter, but something didn't work, which meant at the beginning of a 10-day trip, I then had to hand pump. I brought one of those little ones. I remember I was in a kibbutz in the north end where you're looking at Lebanon, and there's no air conditioning. I'm like, this is so fun. I love, other side, right? And my colleagues have been really good about it. There have been times when you have the 2-minute votes on the floor, and when I first brought my son back, in fact, Lucille was the one that she got this picture. I love it. I was in committee with him. It was 6 weeks, and he was a little guy, so I just brought him with me into committee, and she got a picture of him, and that's one of my favorites. But, when they're that age, they just expect to eat when they're ready to eat. And if you get called to the floor during appropriation season, it's 11 o'clock. Can't leave your kid at home if there's nobody else there, so you're like, come on. And, of course, they're very upset with you. I will never, there were times there where I thought, oh, my goodness, I'm just going to have to do this on the floor, which I know some people are like, do it. And then other people are like, don't do that. And here I'm just thinking, I just want to get my votes in and feed my kid. This is ridiculous. And, so you go in the cloakroom and you they're the windows for talking on the phone. It's very 1950s. And you're putting a blanket over there and you're shutting it. And people just look at, all these guys go by and these are not necessarily the younger guys, right? It's a little bit more seasoned of a group. And so women didn't do this, and you're just like, nothing to see here, folks. Just keep going. I will say Kevin McCarthy was awesome. He's let me pump in the back of his car, his detail car, right? With the Capitol Police, they kind of walk back, but they're nice and dark windows. He's also got a room off the floor that he's let me use a time or two. So it is, I think just the exposure is helping bring the awareness. It's not out, sometimes it's pushing legislation, but sometimes it's just, hey, this is what every family is dealing with right now. There's so many moms I know that have to work or want to work, and they want to breastfeed their children, and this is something that we have to change. As I mentioned earlier, I have 2 kids. So my first, Abigail Rose, I got pregnant with her after my first re-elect, and I waited until I was, almost 5 months to announce it, because I was told that's what you do. You wait till you get to a certain point. And we announced we were pregnant, and then about 2 weeks later, I went in for the anomaly scan. And at that point, we were doing the midwife program at GW, and I was gonna go all no epidural, right? I was gonna be that. Didn't happen that way. Found out that she had bilateral renal agenesis, which for the non-physicians, that means that in utero, her kidneys never formed. The cells just died, or we really don't know what happened, but no kidneys, no pee, no amniotic fluid, no lung development, and the baby either miscarries or they, with 100% certainty, will suffocate upon birth, right? 100% fatal. So I then had to make that public, and that was a really, really, really challenging time, right? I will never forget walking onto the floor, and I will never forget the humanity of my colleagues from all walks of life, all genders, all ages, who would pull me aside on the floor and share with me their story. This family had 5 miscarriages. This one lost a kid after they were born. This one lost an adult child. And they were doing it to share my burden. But it was pretty heavy. It really gave me an amazing cross-sectional view and a respect for my colleagues that, in this weird environment, you group off and it's them versus us, right? It was amazing. And the support I got was amazing. Fast forward, my husband and I decided we were just gonna pray for a miracle, and we were gonna have this baby. And fast forward to today, in fact, I just dropped her off at preschool. She's gonna be 5 this summer. She will rule her own country at some point. Oh, it's terrifying. The firstborn girls, man, they're freaking intense. But she's amazing. She's absolutely amazing. And because of her, other babies have lived, right? Because we had to walk that out publicly. But now other babies have followed the same treatment that we got and are able to reproduce the results. Not everybody. I get calls from all over the world because women say, I want to do what you did, and nobody will treat me. And I got kicked out of several practices before I found one that would take a chance, because the expectant management is the only model that they had for these babies. But the bias it's endemic. It's ridiculous. So I have about 5 different docs across the nation that I try and get these moms to. And imagine getting a mom who's on Medicaid. And Medicaid is all well and good if someone within your state's borders will treat you. Medicaid doesn't follow you across state lines, and that's something we're working on, both for children who need specialty care, right, because we're not going to have a specialty children's hospital in every place, but those kids deserve to get to go where they need to go, and for those moms. Even within your own district, someone who's not in your district can't email you. It's like an ethics thing, right? You're supposed to serve your constituents first and send people to their representative. This one mom from I don't know if it was Mississippi, it was a southern state, poor, black, and I don't even think she was 18. And she figured out an address in my district to put in to be able to email me. And she basically said, why can't I get the same thing you got? My baby's just as important. And she was 100% right. And we did everything we could to get the Medicaid state managers to help us get across state lines for her. And we weren't successful. I can't tell you how often that happens. So just my own experience, we're trying to break down those barriers. And you'd be surprised, just even within the system designed, not just Medicaid, not just the insurance piece, but the provider piece is a really big part of our challenge right now too. So if anybody wants help on that one. So Abigail, I mentioned, so she was a 28-weeker, so she got breast milk for a year, because in a situation where you're doing peritoneal dialysis on a tiny little preemie, an infection is it's a game changer, it's a life ender. So of course, the best possible thing we could do was make sure she had breast milk. And then, you meet other moms in the NICU, and it's like your one thing you can do. Like, I can't control everything. I don't know what's going to happen. My daughter's in, the care of these physicians. And you're with the other moms in the pumping room, and everybody's pumping, because that's the one contribution you can make to make sure she's in a better place. And boy, that really sold me on breastfeeding right there. That was my contribution. That's what I could do. And I know that we kept her healthier and stronger because she was able to get that. Because I had such a great relationship with my pump. I survived my pregnancy. My second pregnancy was, my little guy was healthy, no complications. But there are a lot of moms who don't here today in 21st century America. And I think one of the hardest things to hear about a devastating health condition is that it could have been prevented. I mean, that's what gets me anyway. And as folks probably in this room are aware, there is a horrific trend with regard to maternal mortality. And unlike any other industrialized nation, maternal deaths in the U.S. are on the rise. And the issue of maternal mortality has gotten a lot of national attention lately, which I'm grateful for. There's a lot of different outlets really following this, telling stories of wives and sisters and mothers dying. And these generally are healthy women. I recently sat down with a young father named Charles, who shared with me the story of his wife. And these were definitely upper middle class family from Atlanta. They'd had one child. I mean, this mom was like a marathon runner. She's in better shape pregnant than I will ever be in my life, right? She was tip top. And they did their research, thought they'd picked the right hospital, and they went in to have that baby, and they came out, and he was a single dad. What he shared with me was, he just thought it was this horrible, all these different errors, and it was an anomaly. And when he really started to be able to process, he realized this was preventable, and this was not an anomaly. This happens too much. And he's really been dedicating his time and his effort to getting a bill passed that I'm working on. It's called the Preventing Maternal Deaths Act. I will never forget his experience. He said, quote, "We expected it to be the most joyous moment of our lives and we walked out into a nightmare." And boy, this is between 700 and 900 women a year who die in America, and 60% of those, according to the CDC, are preventable. So I believe we're in the midst of a national crisis. And the good thing is we can move this in the right direction. I'm guessing most folks here are familiar with this bill, but we now have over 130 co-sponsors. It's completely bipartisan, and I have gotten confirmation that we're going to get to vote on this in the next couple months before August. Now I'm along the lines of, I think it was Reagan who said, trust but verify. So I got the commitment, but we're going to keep as much pressure on as humanly possible in order to get this across the finish line. And, my thing with this is not an earth-shaking bill. It's the common sense. We're going to make sure every state has a maternal mortality review committee and that every maternal death is investigated. Because here's the kicker is we can't tell you exactly what it is that's causing this. It depends on the area. There's so many different things that it could be. But we need to standardize the information and consolidate it into one place and read the data. It's a very small piece of the federal budget, so money well spent. I'm very hopeful we're going to get this in the next couple of months. I believe this is also one that's something like it is moving in the Senate, so we have a fighting chance on this. I'm very excited about it. So that maybe we'll get to the point where no family walks into the hospital who's healthy and expecting things to go well, or I should say at least we'll make it safer for women to give birth in this country. I want you to know that your opinions matter, that your willingness to be a part of the federal policy, to make your expertise and your passions heard makes all the difference. It's probably a pain to have to schlep up to the Hill and tell your stories, and some of you probably have to do it year over year over year. But if you don't do it, someone else will fill that slot and a different issue will move forward. And I tell folks sometimes policy is like farming, and I don't know if there's any farmers in the room, but I grew up in a more rural area. You plant a seed, you till the ground, you fertilize, you water, you weed, you take care of it, and it sometimes takes a couple of years before, I have these 2 fig trees right now. almost 3 years old, and I'm just praying fruit onto those things. Like, I want fruit, but I'm not going to get it. I have to keep at it. And so there is a point when legislation does bear fruit. Sometimes it's shorter, and it's that magical stars align and you get it moving, and sometimes it takes longer, but your willingness to do this is what is going to change the outcome for so many women. So I appreciate your willingness to do it, and for letting me be a part. So that.
We have a few minutes for questions. If you have a few minutes for. Okay, to the mics. Just who you are, where you're from.
Chad Abrish, Executive Director at City Match. We work with local public health departments.
Okay.
Thank you for everything that you're doing, and a particular thanks around maternal mortality reviews. 2 quick plugs, maybe just for consideration. Having worked with some of the states that right now are funded, I believe there are 12 states that are funded through CDC. And one of the things that isn't happening yet but really needs to happen is maternal interviews. Of course, that's difficult with a mortality review, but we can do morbidity reviews.
Yes.
We can also think about key informant interviews, but key informant interviews can provide great information, but not necessarily woman's voice. So morbidity reviews.
I didn't even mention the morbidity, and that you're absolutely right. You know, we talk about the mortality numbers are horrific, but the morbidity numbers are just as scary.
That's right.
And I think you're right on with that.
And then I think this goes hand in hand, but another thing maybe to think about is the partnership between state health departments and local health departments. They both play different roles. Hal was here yesterday from ACOG, and they have a very long-standing fetal and infant mortality review that takes place at the local level. And those local reviews do a lot to get at woman's voice and community dynamics. So maybe something to consider there as well.
Critical. I mean, it's like anything. The closer you are to the source, you're going to get the best information, the most accurate information. So I appreciate that. You know, our review committees would go through the states because the states have to opt in. But I think my goal is to get this piece over the finish line, and then we can expand. Because right now, some states have them, and some states are functioning well, but it's a far cry from all states. And then the comparable data you're comparing apples and oranges. So I feel like this might even just be the first step, although I'm not telling my colleagues that. It's like, it's the first step, and we build on it. So I think you're spot on.
Hello, my name is Binta Beard. I'm here in my hat as one of the leaders for the Make the Breast Pump Not Suck Hackathon.
Oh my gosh.
And Make Family Leave
Seriously.
Not Suck Policy Summit. So you touched on a lot of the things that came up as part of that convening. And it was very refreshing and shows why it's so important to have mothers of young children who are representing us in government at all the different levels. And I completely agree in terms of the importance of building relationships with our lawmakers at the different levels. A question I have for you is in terms of messaging that. At times, some of these issues are seen as very gender. That's a woman's issue or that's a kid's issue. And in your experience, such as with the Babes Act, getting support from your male Republican colleagues and even male Democrat colleagues. But what are some of the recommendations you have if you're talking to someone who may first hear this, breastfeeding, that's like a personal choice between women and their kids, and realizing this is a family issue, it's an economic issue. If you're meeting with like members from Louisiana or Mississippi, where that may not necessarily be generationally where they're coming from.
Oh, yes, generational and the regionality you're hitting on. I haven't found as much, So some of those are questions I have, and I've been doing this now for 8 years. And I'm like, and sometimes I quiz people, sometimes I push, sometimes I wait and listen, sometimes I pray, sometimes I get other people to do it. So honestly, it's like whatever tool works, and it's going to depend on the person. First step in anything at any time is relationship. Right? In any job you have, whatever you're doing, relationship is the first step. And so I would say with lawmakers, build a relationship. And is if you feel like it's apples and oranges to go and meet with a certain person, you just got to start. And what I have found, lawmakers are like anybody else. They get the worst rap, and there are a couple schmucks, but for the most part, everybody is there because they want, you want to do this, right? You want to make a difference. And so recognizing their humanity, sometimes you have to smack somebody, but that's 1 in 10, right? And I don't mean physically smack. I'm not advocating for violence. I'm saying sometimes you have to use you got to shake it a bit, right? You got to be a little bit more aggressive. But that's maybe not even 1 in 10, right? What's the expression? The honey versus the vinegar is going to, right? So build that relationship. And once they know that you're there for a cause, people are always coming at us all the time. You're always trying to make a decision about, does this person really, or what they're telling me, can I trust this enough to go out on a limb? And so if they know you, they see your face, they know you're just here working on it, then they're going to begin to trust going out on that limb. And I say this, I don't mean to make everybody sound infantile, but it's like in anything. And showing up is the first half of the battle, building the relationships the second half. And then you're going to know. You're going to be able to say, with this person, I think we need to get a few more of their constituents in this situation in front of them. Maybe we should do some letters and say, hey, thanks for doing this. And in addition, here's the next step. Very rarely do you have to start with, hey, you big, giant jerk, you're not on this. I mean, they didn't even know about it. So it's kind of commonsensical, but you don't think about it here because, it's not a really commonsensical place.
Thank you.
Thank you. And please, I think it was the Wall Street Journal last year I was reading about some companies finally starting to look at the freaking plastic cup things, those, the thing that sucks you in, that thing. Like, why do those have to be hard and plastic? Anyway, don't get me started on that one. I will say, though, so with my second one, I was like, I can totally do this. I can totally do this. And I think I went back for 3 or 4 different, I had to go back for many, many it was bad. There were times when I thought, I totally know why women don't do this, because it hurts, and if the latch is wrong. But, there's some great online resources as well.
Hi, I'm Melissa Bartik. I'm an internist and breastfeeding researcher from Cambridge Health Alliance and Harvard. And I appreciate what you're doing, including the Latina breastfeeding forum that you hosted on the Hill last year, which I spoke at. Anyway, thank you. I'm just trying to wrap my head around how you function as a member of Congress and commuted 3,000 miles while having a critically ill child, and I'm wondering if you could say a few words on that.
Yeah, wow. I have an amazing husband, and not everybody gets to say that. I realize that, but for me, that's a linchpin. And so he was in law school out here. Him and I we're both from the same area. I grew up in my district, and he's from just south of the border in Oregon. But we met out here, and so he traveled back and forth. We didn't have kids when I first got the job, so we started law school. And then when we got pregnant with Abigail and we had her, all of a sudden we had to do peritoneal dialysis. And my original plan was you just schlep a kid around, right? You just bring them with you. Well, when you got a preemie on dialysis, you can't really do that. So he quit law school and stayed home with her full time. In fact, he barely just returned to work. And so that's my answer. And that was hard, man. You question yourself, how could I possibly leave my kid during the week and come out here? And the 3,000 miles and the 3-hour time change, you look at someone who's from New York and you're like, hey, that's an easy commute. But from here, that was definitely, him and I together had to make the decision, is this still the right move? And we've done that every 2 years. Do I still do this? But even now, right? I look around and I'm thinking, good grief, wouldn't it be awesome to stay home with my kids? That'd be so fun. But the grass is always greener, and you have to make the decision like anything, like any mom. Some moms don't get to make the decision, right? They just have to do it. They got to make it work. I could tell you there was a single mom who came into my office with 4 children, 2 of which had disabilities. Not disabilities, one was spectrum. They had some major challenges. And her husband had taken off. This lady was way tougher than I will ever be. People are like, how do you do it? And I'm like, she's so amazing. And she was talking to me about trying to get an exemption because we're a border state. She wanted to be able to go to the major medical center across the river from us in a different state. but Medicaid was making her go up north to Seattle, which is a 2.5-hour drive. So that's part of. So I think about someone like her, and I think, well, this is hard, but I can make it better, right, for her. And that's part of what our contribution is. And so my family, we look at this like this is our contribution for this season. So my kids now do both fly. So my husband, oh, can't believe I didn't mention this. He gave her a kidney about 2 years ago. Yeah, I know, husband of the year, right? Yeah, I know. He's amazing. And she's doing great. So she's a transplant kiddo, and she's just like I said, like, I'd be lucky if I get a job for her someday. In fact, she tells me that. I'm going to run for office because I bring her to the floor, and she's quite a hero. Everybody knows her. Everybody. She like holds court. And you know when you vote, you got the names on the wall, and she's always looking for my name because she always votes for me. And she was like, "Where's my name?" And I was like, "Well, babe, you got to run for office." And she goes, "I'll run for office." And I was like, "Okay, what office are you going to run for?" And she goes, "Yours." Okay. So, yeah. Anyway, I should also say my staff. My staff also. My people in my district didn't suffer for that. My team really rose to the occasion. So I mean it.
And they're here.
Two of them are in the back. Yeah. People make you look good, right? Yeah.
Hi, Ruth Peterson from CDC. I run the Division of Nutrition, Physical Activity, and Obesity, and thank you for the $8 million to the hospitals that comes to our division.
Great.
And I really do appreciate that investment that you helped make in the country. Yeah. I want you to know that we wrap that around, not just from the hospital setting, but with the other resources we have and with all of our partners that we work with, including ABM.
Good.
We make sure that work then intersects at the community level. And our other funding lines, such as the racial and ethnic approaches to community health, then works. We interdigitate all that work together at the state health department, the local health department, and the community level. So you have no idea how much an investment that sounds small from
budget.
What you deal with actually then translates to at the ground level where people are working together to promote breastfeeding, especially for those women who have it the hardest. So just thank you so much from us, and we appreciate your effort.
Thanks for making it count, for the leverage, right? For it's like seed money and for multiplying
exactly.
it. Yeah.
And your presence here today says a lot too, so I appreciate that you took the time to do that. This is a great organization. Thank you.
Thank you.
Hi, my name is Alison Steuby. I'm a maternal fetal medicine doctor in North Carolina.
I've met many MFMs.
Yes, and Jessica Beanstalk actually interviewed me for residency a really long time ago. So,
oh, really?
Yes. So, and I'm also president-elect of ABM and an active member of Moms Rising. So I think we have a lot of shared friends.
Cool.
We've been fortunate to get funding from HRSA, which you probably were involved with, around looking at the unmet health needs of moms of medically fragile infants. So when that baby's in the NICU, who's looking after mom, which is not anybody at the moment. And I think I wanted just to first applaud you for the Preventing Maternal Deaths Act, and then make sure that there continues to be a push for HRSA and NICHD and NIH to fund work about mom's experience.
Yes.
Because so much of the work on breastfeeding, for example, is about breast milk and what breast milk does for babies, without a consideration of how the breast milk gets out of moms, hence the crappy pumping experience.
It can be such a terrible experience.
So I know the PregLac Task Force is going to report on recommendations. There's just been minimal work on things like low milk supply and pain and how to manage those. And to the extent that Congress can direct our research organizations to look at that.
Like good report language. Are you able to help us with ideas for report language?
Oh, yes.
So Anna is does my health stuff.
Perfect.
On the committee. So it'd be great if we could get your contact information. So I'm always looking. We get a lot of report language, but sometimes it's so much of it is so dependent on who we're talking to, right? So yes, I think you're absolutely right. I almost quit so many times because it was so ridiculously stressful. My first environment was a NICU environment, and I think the first vote I left the hospital for was to come back and vote on Syria. Like, are we going to do a strike in Syria? And I was like, and I'm pumping in an airport. So I get a piece of that. And there's nothing there. And if you're a single mom and you've got multiple kids, and we met many of these in the hospital, like I said, they're tough. So let's do what we
Excellent. Well,
can.
we will
Yeah.
connect.
Thank you.
Hi, my name is Lourdes Santavalla. I'm an IBCLC and infant and child feeding specialist in Puerto Rico.
Oh, cool.
And I just want to do just a push. I think that you're the right person, that when it comes to appropriations, to make sure that it's not just for the 50 states.
Yes.
Okay?
Jennifer Gonzalez Colon is a friend of mine. She
Okay.
represents Puerto Rico.
Okay, yes.
She's the delegate, and she has done a good job building relationships. So she doesn't have the actual vote,
Right.
right? But she's done a good job in making sure that Puerto Rico. In fact, actually, I have a new poster from a child in Puerto Rico of a church I just visited about 3 months ago. She invited us out just to keep it in front of us and fresh. So thank you.
All right.
And it is, I'll say, message received.
Thank you.
Yeah, thank you. Yeah. All right, thank you.